Hi everyone, welcome back to Beyond Your Knowledge. So today we are going to be studying polycystic ovary syndrome. So we're going to just see a few points here. And before we continue, I would like to share with you Hebrews 6:11-12. And Hebrews says that, and we desire each one of you to show the same earnestness, to have the full assurance of hope until the end, so that you may not be sluggish, but imitators of those who through faith and patience inherited the promises. Amen. So for polycystic ovary syndrome, we're going to see a table here, and basically in the table we're going to see the clinical features. Let's just do it in black first. The clinical features and then the treatment. Okay. So the treatment, let's just here. Treatment. There we go. So those two, let's just put it here. We can have more room. Okay. So with that in mind, let's just continue. Okay. So we split it here. Nice and cool. Let's see. Okay. So the clinical features, we have four things so that we should remember about the polycystic ovary syndrome. So what are those four things that we should keep in mind? So the first one, it is that androgen excess. Okay. So if the patient has an androgen excess, so what do you think is going to present? Usually so the woman is going to present with hirsutism. What is hirsutism? Hirsutism is an excess growth of excessive. Okay, so an excess growth of the hair in the face, on the face. Yeah, hirsutism. Also, the woman can present with acne, with androgenic alopecia. Okay. Okay, so this is one point. The other point is ovarian dysfunction. Okay, so the ovary is not working well. Ovarian dysfunction. So how this is going to present? Well, if the ovary is responsible for the menses, so it's going to have menstrual irregularities. What else? Menstrual irregularity, or also, like the name said, polycystic. So it's going to have polycystic ovaries. Okay. Polycystic ovaries. What else? So with ovarian dysfunction, those two. Now also the patient can present with insulin resistance. What are the consequences of insulin resistance? Well, we're going to work with that right now. So, but we need some more room here. So let's just keep some more room here. Okay, so in insulin resistance, we have one more accelerator here. Okay, so now what are those? So first, the patient can present with acanthosis nigricans. Okay, let's see. So I will show you a picture of acanthosis nigricans. This is the picture of acanthosis nigricans. And yeah, so basically what it is acanthosis nigricans, so it is a skin, okay, it's a skin condition characterized by dark, so you can see here this dark area, okay, and velvety patches in the body folds. This should be one of those folds, okay, those here, and creases, okay. So basically this is acanthosis nigricans, and that's present when the patient has an insulin resistance. What is another thing that the patient can present with insulin resistance? So it is glucose intolerance. So it's going to be glucose intolerance, and if the patient has a glucose intolerance, that leads to diabetes, okay, and or the patient can get developed metabolic syndrome. Okay, so those things, metabolic syndrome as well. Now, what about if the other one that we are going to mention here, it is let's see, there we go. So the other one that we can mention here is that the patient can present is with obesity. So the patient with the polycystic ovarian syndrome, they can obesity is one of those causes. Well, I think that we don't have to describe obesity because we know what it is. Or yeah, so basically obesity, so since obesity is one of the causes, so what obesity, so a treatment here, so it's okay, let's just talk about treatment at the bottom, sorry. So let's just be more organized. So now we're going to talk about the treatment. And what is the treatment for this kind of patient? So, well, the one that I was thinking to mention is weight loss, and let's see, I see it, I think that this should be blue, so okay, so weight loss. The other is combination hormonal contraceptives, okay, hormonal contraceptives. And then one more in the treatment is metformin. This one we give it. Yeah, so metformin is when if the patient has if the patient is hyperglycemia or diabetes. Hyperglycemia, that's better, or diabetes. Okay, so and yeah, so basically this is this is all about polycystic ovary syndrome, just the clinical features and treatment. There is more things, so which the causes, for example, that could be so there are more details if we're going to talk about the causes of hirsutism. For example, hirsutism can be due to polycystic ovarian syndrome, we mentioned, Cushing syndrome, ovarian and adrenal tumors. And why hirsutism happen, I would like to share this point with you. Because the patient increased the local conversion of testosterone, okay, of testosterone to dihydrotestosterone. This is the abbreviation for dihydrotestosterone, okay? And then, or the patient has hair follicles to sensitivity, or sensitivity to the hair follicles of dihydrotestosterone, okay? And or the receptors are sensitive. Okay, so yeah, I think that with that in mind, we can just take a break here and remember that this is all about study and trust in the Lord. Thank you so much, and we will continue learning. God bless you all. We can do all things through Christ and God bless.